My name is Dr. Frank Vicini. I'm a radiation oncologist for PrecisCa USA. I primarily treat breast cancer and have been involved in multiple studies looking at the treatment of breast cancer with radiation therapy. Brachytherapy is a type of radiation therapy delivered from a radioactive source. In other words, there's two ways in which radiation therapy is delivered to a cancer or to a target. It can either be delivered through a machine called a linear accelerator, in which case high energy radiation is directed to the target, in this case the breast, or radiation therapy can be temporarily positioned within the target, that is within the breast, for either a permanently or for a shortened period of time, but the radiation therapy comes within. In other words, it's placed internally into the target as opposed to external beam radiation therapy, which comes in from the outside. Now, there's two different types of brachytherapy. There's what's called low dose rate brachytherapy, and that's delivered either through permanent sources positioned in the breast or temporarily in the breast, or the newer form of brachytherapy called high dose rate brachytherapy, where a high energy radiation source is temporarily positioned in the target, in this case in the breast, to deliver a very targeted dose of radiation therapy to in this case, probably the lumpectomy cavity, but it only stays within the target for about several minutes and then is retracted into a cylinder called a high dose rate unit, a remote afterloader. Now, in the past, brachytherapy was primarily used to deliver boost treatment to the breast. In other words, conventional radiation therapy delivers a certain dose to the whole breast, and then a booster dose is delivered to the lumpectomy cavity. That's kind of considered the standard course of radiation therapy. Well, you can use brachytherapy, either low dose rate or high dose rate, to deliver that booster dose of radiation therapy. And the logic behind that is by targeting the radiation within the breast, you spare the normal tissues surrounding the breast. More recently, brachytherapy has been used to deliver the entire course of radiation therapy for a patient, and those are patients who are considered to be candidates for partial breast irradiation. So in other words, those patients do not receive any whole breast irradiation from a linear accelerator from a machine, and their entire course of radiation therapy is temporarily delivered with brachytherapy focused on the lumpectomy cavity region. Now, the issues with brachytherapy through the years is that there is a bit of a learning curve, and so not all radiation oncologists are experienced within it, but if a patient is interested in brachytherapy, they should talk to their radiation oncologist. Again, it can be used to deliver part of the radiation through standard breast conserving therapy, or it can be delivered as the entire radiation therapy known as partial breast irradiation. So brachytherapy has been around for 50 years. It's well understood, and it's just a different way of delivering radiation therapy from within, as opposed with machine radiation with the X-rays coming from the outside.